Hi, I'm Jordan Killpack. I'm the Clinical Director here at Elevations. This is Clinical Corner, and I'm here to answer some frequently asked questions. And the topic for today is transitioning from wilderness to residential treatment. Do we have many students transitioning from wilderness is a question that's often asked by parents and educational consultants and others considering coming into our program. And the answer is yes. Somewhere just over half of our students come from wilderness programs into residential treatment. Another question that's often asked is, what are some of the challenges that students and parents experience when transitioning from a wilderness program to a residential treatment program? I think there's both pluses and minuses that go along with that. Some of the advantages that a student has is they often come in with some momentum into treatment. They've completed some important treatment aspects in the wilderness program. And I think one of the things that parents are struggling with when students come in is the therapeutic curve. There tends to be a very steep, quick, easily seen change in wilderness because the environment is very intense and very focused. And coming into residential, that curve flattens out some, and we're looking for longer term, longer lasting change in the student and in the family. And so sometimes that feels like things have slowed down, and that can be a struggle for both parents and for the students. Another question that's asked is, will we have family therapy, or how soon will we have family therapy when we come into residential treatment? We typically want the students and family to wait about 2 weeks before they start family therapy. The reason for that is it gives the students some time to engage in the programming, to get oriented and kind of learn what it is that they need to be doing. And it also gives parents a chance to kind of sit back and take a breath and sort of evaluate where we are. And that gives both the parent and the student some chance to increase their engagement, and often it helps the student to hopefully get past some of the wanting to be pulled early or taken out of the program before they're really ready. Okay, another question that's often asked is, how do we prepare students as they come into treatment to transition from wilderness into residential treatment? One of the things that we offer students is called Base Camp. It's a series of groups. It's run by a combination of one of our primary therapists, our nursing staff, and our nutritional education consultant. The Base Camp really helps students learn about treatment planning. It helps them learn about how to engage in treatment, helps them learn the expectations, the rules, and the systems that they're going to be involved in while they're in residential treatment. They also get a section from nursing on physical and sexual health, and then they get a section from our nutritionist on healthy eating. Another question that's often asked is, does it make a difference in their treatment trajectory through residential if they come in from a wilderness program? And the answer to that is, it varies. Most students do come in with some momentum. They come in with some important treatment components that they've worked on in wilderness. And so I would say overall, it helps students to sometimes engage a little bit quicker and to build on that momentum. Although some students will continue to struggle as they make that transition. Although what they've done in their wilderness treatment can often be a very helpful component to build on as they come into residential. Okay, if you have additional questions regarding any of our programming or anything else, please reach out to myself or to our admissions team to get those questions answered.